How are you today?
I think doing well. How are you?
All right, awesome. This is so cool to do this on live. I think this is my first time doing it with someone on live.
Wow.
So yeah, thanks
It's,
for facilitating.
of course, my
Uh,
okay. So Avi, you are the phobia expert, specifically with dogs, but many things. Today we're going to be talking about the dog phobia. So,
all right,
so let's get right to it. Yes.
let's get right to it. Dog phobia. Um, all right. So one of the biggest things in my practice, I'll introduce myself and what I do. I'm a clinical psychotherapist. I work with families, with children, with couples, dealing with a lot of different types of life challenges: anxiety, depression, PTSD, OCD, things like that. And one of the biggest things that come up in my practice, being that I also, a big part of my practice is that I work with animals. One of the biggest things that I see are people who have a fear of dogs, but specifically either fear of animals or fear of going outside and driving on the highway and all these different types of fears. And the biggest thing is gaining back control. So one of the main questions I ask people in one of the sessions towards, I do like a questionnaire, and towards the end I would say, do you like to be in control? Right? And they look at me like, what are you talking about? Right? They say, do you like to be controlled or do you like to be in control? And I don't think anyone has ever told me I like to be controlled. I think everyone told me I want to be in control. And then when we kind of show them the situation and say, when you're in a room with a dog, who's taking control? The dog. I had somebody who said, I'm so afraid of birds and I can't go to the beach, and I love the beach, but I can't go to the beach because there are birds there. I can't fly on a plane because I'm afraid that there might be a dog there. So when we know we have a problem is when it starts to affect our activities of daily living. Part of exposure therapy, it's never for a person to be able to come and touch a dog and play with a dog and even buy a dog. That's not the purpose of exposure therapy. The
Mhm.
purpose is for you to be able to live your life without that stress response every time you go to do something, going to the grocery store, going to an elevator, going to a friend's house, not having that type of fear. So, what are your thoughts?
I love that. I love that. Like you make it so clear that you don't have to like love dogs. You just don't want it to interfere with your daily every
Exactly.
life,
100%.
and also that control piece is brilliant. Like anything that we need to navigate our daily life around really controls,
Yeah.
even though
Yeah.
we're being in control by like mitigating any way of not, having that fear attack us. We're really giving our control to that thing. So really,
Absolutely.
that mind trick is brilliant, and I think it helps motivate people to be like, no, I need to overcome this because I really want to authentically be in control of my life and not in
Yeah.
pseudo control.
Yeah. Absolutely. And this is the biggest piece that we see is a lot of times when people come in specifically for when they come in for overcoming their fear of dogs, many other areas of their life they're able to now take back control. Like with children, I see this, they build more self-confidence. They're able to make their needs known. They use their words to let people know how they're feeling. And with adults, a lot of times they'll work and they'll say, I have fear of driving on the highway. And they notice that they use the same concepts with exposure therapy, driving on the highway, and that works for them as well. So, we'll go through a list of series of questions that you may have to see how a person can overcome this fear. And yes, it is possible. And we'll talk about the anxiety and how the brain is so powerful to create scenarios that are not there, right? Like, for example, when I'll work with a person and they'll say, of course, we'll do a questionnaire, we won't, my techniques of working is not specifically flooding. Like, when a person comes into the sessions, we never have an animal there. We'll do the questionnaire. We'll do it systematically in a way of understanding where they're holding. And through that, we'll bring on the exposure. Now, this is an uncomfortable journey, right? Our brain always wants to be comfortable, right? And safe, right? So that's why whenever a person sees a dog, what do they do right away? They go into that fight or flight response. And sometimes you have a case where you freeze, but usually they will run, right? Now, in order to overcome this anxiety,
Mhm.
you need to be uncomfortable, right? So,
Like all
so
right, like anxiety is facing the unknown and being uncomfortable about it. Exactly.
Exactly. It's getting comfortable with uncomfortable, you know.
Exactly. Yeah.
So a lot of the times, a lot of the times we see people whenever they see the dog, right, and they try to run, and they say, no, 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 I don't like, don't calm down. I'm like, okay, what are you afraid of? I don't like the mouth. Okay, what are you afraid of about the mouth, all right? Or they say, the dog is looking at me. I'm like, okay, the dog can look at you. You
Right.
can be uncomfortable, but as long as you're safe, right? So I have this like affirmation that I say with my clients. Even though I'm uncomfortable, I'm safe. You know,
Mm-hmm.
safety is a very big key because we never want to put a person in a position where they feel like they're trapped, they cannot leave, they're unsafe. So we definitely don't want to do that. So a lot of the times when you'll have, I'll have clients crying mid-session, and I'll check in with them and say, okay, what's going on right now? Talk to me. Use your words. Allow yourself to take what you're thinking and transfer it through your mouth and tell me what your thoughts are. Because sometimes when people speak the words and they hear what they say, they're like, oh, wait, that kind of doesn't make sense.
Mm-hmm.
And then they're able to kind of start to reprogram their mind. You know, part of being a therapist, I also, I'm a hypnotherapist as well. So once I finished my schooling to be a psychotherapist, I wanted to study the brain a little bit deeper and understand why is it that even if I were to come to you, let's say, and say, here, look, I have, and let's just say you were afraid of a dog, and I say, here, it's such a cute, white, little, fluffy dog, pet it, consciously, you understand that it won't hurt you. But
Right.
subconsciously, you have to run. So it doesn't make sense. What's going
Right.
on, right? So in the school of hypnosis, we use 12% of our conscious mind and 88% of our subconscious mind. So it's the same thing like when you have a smoker, right? A person who smokes. Usually in the beginning, when you have like a teenager starting to smoke, what do? In the beginning, they smoke, and they really don't like it, but they do it because they have to be, you know, it's peer pressure, they want to be cool, right? But what happens later, 10 years down the line, what do you hear for your smoker say? I really want to quit smoking. It's expensive, it makes me smell bad, it's cold outside, right? They say all these things, so you ask them, so stop smoking. But they can't because it's already registered in their subconscious mind, which is 88% of functionality, which is much stronger. So really what we're doing in exposure therapy, we're starting to rewire the brain. And it's very uncomfortable. It's almost like, think about working out. We go to the gym, right? We go to the gym, we work out. If you come into the gym for the first day and try to bench press, 200 pounds, it's not possible, right? So you start off small and then you'll get there. Same thing with exposure therapy. We're building the muscles in our brain. What are your thoughts?
I'm following everything. So I'm curious, like, what would you say exposure, if someone's considering coming to exposure therapy, what does it look like? Break it down.
That's a very good point. So I'll do a questionnaire, an assessment, and see, first of all, what brought you here? Why do you want this change, right?
Now.
Exactly. Why do you want this change now? Sometimes, and we'll get to that in a moment, but I want to just express one very important point. I was working with somebody. And of course, in terms of all identifying information is going to be changed just to protect the confidentiality of the client. But I was working with someone for a number of weeks, and for some reason, something just wasn't clicking. And I never had an experience like this before because I've been so far very successful in helping people. And at a certain point, I told the client, I said, I'm not understanding what's going on here because I'm doing everything right from my standpoint. So at this point, there's a saying, you can bring the horse to the water, but you can't make it drink, right? Same thing here. What's going on? Where's the disconnect? And the person said, well, I really don't know if I want this. It's another person in my life who really wants this. Let's just say whether it was a spouse or it was a child or it was a parent, right? This person really wants for me to do this. And then I said, now it makes so much more sense. So then I told this person, I said, at this point right now, you have to decide, do you want it or are you doing it for somebody else? Because if you're doing it for somebody else, we have nothing to talk about. It has to come from within. In that one session, and the person decided to do it for themselves, in that one session, we were able to achieve what we were trying to achieve within 5 sessions.
Wow.
You know, we have to understand the power our brain has. So a typical session would be me taking an assessment. Why are you trying to make this change now? So you have different scenarios. A person saying, I want to go on vacation and my friends are going to be very upset if I can't go to the beach with them. Or I live in a building and there's dogs there. Or I work somewhere, I work in somebody's house and they have a dog, like let's say an OT, a PT, any type of, special education teacher, right? They go to somebody's house and they have a dog there. So it's starting to affect my activities of daily living. And the last question I say is, do you want to gain back control? Do you like to be controlled? And usually they say, yes, I want to be in control. And then we'll start off, of course, with every single client. I'll make it a little bit different based on their level. And then I will use some techniques to expose them a little bit at a time. So I'll use puppets. I'll use different types of animals, or I'll show them a picture, and I'll see where they're holding. And surprisingly, sometimes even when I use a fluffy animal, even with adults, they can start crying and having a reaction. And I'll check in with them and say, I just noticed when I brought out this puppet, you started to have a reaction. What's that about? And we can talk about that inner feeling that they're experiencing and staying there, staying in that moment. Because a lot of times when people feel anxious, they want to leave that state of mind, right? But it's so important to be uncomfortable, because when we're uncomfortable, we start to create that pathway and we start to make change. And slowly, slowly, I will actually go and bring a dog. Now, I will tell you like this. I've worked with people who've tried other things and mentioned it hasn't worked. So the people that come to me already say, you know what, I went to a therapist, I went to a psychologist, I tried to do it with pictures and videos, and it doesn't seem to help. To be honest, I don't know how something like that can help. If you're not in a place with a real dog, you're fooling yourself. You're cutting corners. You need to be with a dog in order for this to work. So I'll bring in the dog. And the dogs that I work with are very well trained. They went to school, and even my training was to really understand animal behavior and body language. That's really what it is. And this is something I give off to my clients, really understanding what is an animal doing? What are they thinking? A lot of times we feel like, oh, an animal doesn't speak English, right? So how can they understand us? So how can we communicate? Every animals absolutely communicate. It's about us giving them the opportunity to connect with us and reading their body language. And this is something that we talk about in therapy. So we bring in the dog. The person looks at the dog, and they immediately, most of the time, have a reaction. Oh my gosh, what's going on? Wait. And I'm like, I'm here. You're safe. You're okay. What am I doing? Right? And I make the client say, you're standing there. You're holding the leash. Right? And a lot of times the clients will say, but it's looking at me. And I'm like, yes, exactly. It's looking at you. So I start to normalize all of the experiences that the client starts to have. And slowly, we get to a place where the animal is able to be on top of the person, and the person is feeding the animal, and we start to see a bond. And interestingly, people are very shocked with how they're doing it. And this can be a very exhausting experience, because when we use our mental strength, it's much more exhausting than using our physical strength, and that's really what we're doing. So after the 45-minute session, you can see the people, the clients like,
awesome.
Wow, that was a mental workout.
Because also the nervous system was like stretched to capacity,
Absolutely. And what's the most this is, I do a lot of different forms of therapy, but this happens to be my favorite one, because you can actually see progress. And I document this progress with the client's phone. I'll take their phone and I'll video them, and I'll take pictures of them, of their process. And because a lot of the times when they're in session, they're in a state of shock. They don't even acknowledge what they're doing. Somebody who's never touched a dog, or somebody who's been petrified of a dog for many, many years, they're now able to do it. So when they go home and they settle down and they watch the videos, they're like, I don't believe I was able to do this. Yeah. And throughout the 5, 6, 7 sessions that we have, we'll track it, and they will be so impressed with themselves how much they grew. And a lot of times, even with children, we'll take the pictures of the children, you also with adults, we'll say print out the photos and put it by your bed, put it next to your fridge, put it in an area that you can see so you can let your mind know that you're on a journey.
Exactly. I love that. And I love a couple of things that you said, specifically that you don't flood, like you don't like freak the client out. Like you're very much working.
Yeah,
And
100%.
it's very important for people to know, because I could imagine people are afraid to come to therapy that they know is exposure therapy. So like
Yeah,
that you take the boundaries seriously, and that you really work with the client, and also
yeah,
that it's really short-term treatment. Like it's people
yeah,
also, they hear therapy, they think like, okay, this is something I have to like bind myself to for like 3 months, 6 months, a
yeah,
year. And that's definitely the case for other therapies. But I think, for somebody to know that they have a fear that's holding them back, and it can
yeah.
be, mitigated within 6 sessions or less.
Mhm. Yeah, yeah, exactly.
You know?
Yeah, exactly, 100%. This specific type of therapy is very different than a typical, psychotherapy session where you go into childhood and understanding what happened in the trauma. Of course, I will ask, and this is a very important piece to understand. In the school of hypnosis, I know, other therapists have different ways of looking at it and different angles to understand. But in the school of hypnosis, this is what I learned. There's a fear and a phobia, okay? A fear is a known origin. You can say exactly how this happened. For example, when I was 3 years old, a dog started to chase me and I fell down and it was right on top of me, right? You can kind of go back to that place to understand the trauma. A phobia is really, it's not really explained. You don't know where it's coming from. And a lot of the times when I'll question the clients, they'll say, well, you know what? My mom is really afraid of a dog, and that's why they kind of took on that fear. Or, my very close friend is afraid of a dog. Or even culturally, dogs were not accepted in that area. There's many cases where you have, from people who are not familiar with, dogs and body language and all of this, and they will be in a state of shock. If they see a dog walking, they can leave their baby carriage and run because they're so afraid. They're not consciously able to acknowledge what's really going on because they're in a state of fight or flight.
Wow, right. And that's such an interesting point, the fear and the phobia. I would think that like the phobia comes from a fear, but I guess that's not accurate, right? Like you're saying that fear,
What do you mean?
like the phobia, like somebody has a fear, so that's because of a specific like origin story, and then that fear goes like untreated for so long and it becomes a phobia. But that you're saying.
So it could be, so there's, of course, there will be an origin, right? Let's say for the mother, for the parent, there will be an origin, right? So let's say something happened to her, and let's say something happened to her when she was 5 years old, and she's holding on to the fear, and now she's 45 years old, and the child never even heard about that story that happened to the mother when she was 5. But every time the mother sees a dog, she'll kind of hold the child back. Or she'll say, oh, watch out, the dog's going to come and bite you, and have this type of conversation. And in the child's mind, they're very receptive. And they're going to take on that fear, and years later not even know, wait, why am I afraid of a dog? Nothing ever happened to me. So we'll talk about a little bit about that to understand what's going on in our mind. Once we have a good understanding of that, we get right into work. We definitely do a lot of hypnotic suggestions, and some people get freaked out, like, are you going to hypnotize me? Or am I going to go under? Absolutely not. But what I do is I let the people know the feelings they will be experiencing. So right before they start, and I come in with the dog, I will let them know, like, hey, right now you may start feeling your heart pounding. You may start feeling sweaty. You may start feeling the need to cry. I would really, if you start to feel that need, do not hold back your tears. Allow the fear to escape your body. Getting them aware over their body sensations as well, because a lot of times you'll see them clenching their fists or biting their lip or holding their body like this, right? So we'll tell them to relax their body, relax their jaw, being very aware of the room. If I notice, now we never want to create more trauma for them, right? So if I'm seeing that a client is panicking and it's getting too much for them, I'll remove the dog, I'll get them recentered, tell me 5 blue things you see in the room, tell me 7 red things you see in the room, so I'll do a little exercise like that with them. We'll do a deep breathing exercise just to get them refocused, you know. And a lot of times, and this has never happened, but a lot of times, when people say, "Oh, this is too much for me. I don't want to do this. I don't want to do this. I'm done." I'll say, "Okay, no problem. I'll remove the dog and I'll ask them to say, do you want to leave? Are you finished? Are you checked out for today?" And then this never happened that somebody actually walked out.
Yeah.
They saw themselves from a different angle, and I asked them, "Look, why did you come here today? You came here to work. You came here to make change, to regain back control, and rephrase that in a way where they're able to acknowledge that, wow, I'm doing work. It's not a place where you come in and, you know, check it off your to-do list, and then you're able to now not be afraid of dogs. This is going to take work, and if a person is willing to make change can absolutely happen, for sure.
I love it. Somebody asked a good question. Does it always take, because I said it takes, you know, like 6 sessions, which sounds very, you know, I guess attractive to people. And somebody asked, does it always take that short? So I thought that might be a good question.
That's a very good question. So generally, when people want to know how long they would have to come in for, specifically for exposure therapy, I tell them within 3 sessions, the client has a very good understanding and knowledge about what it is. They've already had some exposure, and usually after 3 sessions, they want to come back and make sure, you know, to get it out completely. Again, the sessions are only 45 minutes. I do also give homework throughout the week. You know, for people who are not able to, for some reason, seek out therapy because of a financial issue, or because this is not a typical
it's very weird to find somebody like you. Like, you know, I'm curious, like, how many therapists specialize in this and have like a pack of dogs and, you know, like, and are really skilled in, like, trained in hypnosis. Like, it's not, you don't find that on every block. So this is actually, I do the same thing with tarantulas also, which is a big thing. We don't think about it, but that is one of the biggest fears in the world, is arachnophobia, fears of spiders and any insects and bugs as well. It's the same exact concept, and we do have the tarantulas here. Obviously, the ones I have are not poisonous, and they're very, very friendly, and they will not harm you in any way. But it's the same concept, where I had a client also afraid of this, and we found one of those, you know, bugs, and we put it by their bedside, and they overcame the fear. The main point of this talk is letting people know, first of all, that there's help out there. Second of all, understanding how your brain works. A lot of the times, before people even acknowledge that, they just run away because, again, your body always wants to feel comfortable. But sometimes feeling comfortable may not be the best thing for you at that moment. Does that make sense? Yes, yeah. So just to answer the question, I think we answered it in a roundabout way. To be clear, I think that it's fair to say that within 6 sessions, people will, if they're
100%.
It
also matters. It really also matters how much work they're willing to put. Like, they'll come in for the 45 minutes, they'll learn the strategy, and a lot of times they'll tell them, okay, now you have to go to a pet store. Now you have to go to a friend's house that has a dog. Does that mean they have to touch the dog? Absolutely not. Even just looking and listening to the sounds and smelling, using all your senses, that's absolutely going to help you in the process of overcoming your fear. And it's also about challenging yourself. You know, sometimes we get too comfortable with a specific type of personality or characteristic that we have, and we're really embarrassed. The embarrassment is the biggest key here. When I work with adults, even with men who are 45, 50 years old, or you know, women, and they're so embarrassed to admit that they have this fear. First of all, there's really nothing to be embarrassed about, because it's not you. Like I said, consciously, you know, even though you're the adult, you have that inner child kind of trapped inside. So a lot of times I'll tell my client, let's say this trauma happens to them when they were 7 years old. I'll say, you know what? You and me will both help that 7-year-old girl, or you and me will both help that 9-year-old boy, you know, and together, and we'll both together kind of go back into that place and help them step by step, taking it very slow, but helping them through. And every single session that they complete, they feel like, wow, I was able to do what I was not able to do a week before. And as a therapist, it's such a good feeling, because as therapists, we can't always measure success. Maybe we can do it like after 6 months or after 3 months, you know. Right. But with something like this, even for clients, And it's like you gain self-esteem and self-confidence and just like a new view on life and the capacity of your brain.
Bruh, bruh, I love it. So I think that's awesome. And yes, I think like it's fair to say that within 6 sessions, people
Yeah,
make a massive difference. And
for sure.
the client, it's awesome for the therapist because it actually works. What could
Yeah,
somebody do if their therapist doesn't have dogs or doesn't treat this phobia, or even someone that doesn't, like you said, have access to therapy of this
yeah,
kind? What could they do in their everyday life?
yeah,
Have this real fear of phobia, and they're willing, they're motivated to work on it, but it's very
yeah,
different self-motivated when there's such a strong fear and phobia versus being
yeah,
self-motivated with an expert like yourself in the room.
yeah.
I think there's different
So,
exposure that can be done.
yeah, for sure. So if a person at this point is not, because of finances, if they're not ready or they don't have access to it, I would say really just getting as much familiar with it as you can, doing your research and reading and learning. The biggest piece of anxiety is the fear of unknown. People don't know how to read dog body language. People don't know how to get comfortable with a dog around them. So if they can go to a pet store that sells dogs, right? There are usually staff that work there, right? So when you come in, you can just say, oh, I'm here just to look.
Mm-hmm.
Get yourself in an uncomfortable position. Obviously, we always have to make sure to be safe.
Mm-hmm.
Safety is a very big part of it. I wouldn't suggest somebody who's not comfortable with dogs, I wouldn't suggest them going into a dog park at first in the beginning, because that can be a very high level of intensity and can re-traumatize them, and we definitely don't want to do that. Safety is always very important, and it doesn't mean if you see a dog, you have to go up to the dog and start petting the dog. Unless you know the owner, unless you know the dog, it's very important as well, because there are some dogs out there who are really not social, and it goes both ways. There are dogs out there who are very social. So first of all, being able to, when talking about words, to ask the owner, hey, can I pet your dog? Is your dog friendly? A lot of times when people are dealing with an anxious mind, they forget that they have the ability to speak.
Yeah.
And using our words is the most powerful tool that we have.
Yeah.
And if we say, yeah, sure, you can pet my dog, and you can also say, this is something new to me. I'm trying to overcome my fear. Usually a person who has a dog, generally speaking, they have a big heart. They're kind-hearted, right? I mean, I feel like I'm giving a shameless plug for myself, right? A dog owners usually are good people, and they'll understand. If you tell them, hey, I'm trying to overcome my fear, they'll be patient with you, hopefully, right? Obviously, if they're not rushing to work, but other than that, they're good people. So ask them. And other than that, just watching dogs, reading books on it, watching videos, that can definitely help as much as exposure as possible.
Your own hierarchy, like, so let's say not crossing the street, like saying, okay, 3 times this week, I'm not going to cross the street. I see a dog if that's what I do, I
Yes.
think like those, on your level, I wonder, like, if virtually working with you would be like helpful, or like you really need the actual physical dog with you. You know what I mean? I'm sure like it could be helpful. It's just not the same as having the dogs
Yeah.
on.
This might sound a little selfish, but as a therapist, I want to know if I can go into something, I want to also set myself up for success.
Mm-hmm.
So working with someone virtually with this specific task, with this specific goal, it's really not the best. It's done. I personally don't do it.
Mm-hmm.
It is done because people can talk about the fear, they can talk about the trauma, they can talk about, the experiences the person had. But when you're getting down to business, you need the dog there, so because you can talk about it, but again, you will not make any change happen because you're not anxious. The only way change will happen is if you're in an anxious state of mind. That's really when the pathways start to be connected. The new pathways start to change in your mind. So that's really what we want. We want to get the person to feel anxious. Talking about, again, depending on the trauma, it can be traumatic for a person for the first or second time to talk about what they experienced, and they can cry and have a reaction. But down the line, it really is ineffective.
Right, right. And I like that you're so straight up about that, you know, like this is the way it works and this is the way,
This
like,
is this
yeah,
is this is my life. This is my
yeah,
passion.
I love,
This means so much to me, and
yeah,
being able to use animals to connect with people and help them. I mean, I love this. This is my life, you know. So, and being able to see such quick change in
mm,
people's lives, and people getting texts from people, getting calls, getting pictures, getting videos from my clients saying, I never in my life thought I would do this. My kids are so happy. My spouse is now at peace. I have many clients who also get animals, get dogs. That's never my goal. I don't have an agenda for someone to get a dog. You know, my goal is for them to be able to wake up in the morning, go into the elevator, go to work, not go on the train or whatever it is, not thinking that a dog is going to come and attack them.
correct. Beautiful. I love it, Avi. Thank you so much. I think like
My
we
pleasure.
so many points and really gave people like good insight, good takeaway. What is exposure? What could you do on your own? Where does this come from? And I like that it's also very much like it's very much exposure based and it doesn't go too much to the past that gets you stuck.
Yeah, 100%. Yeah.
People are seeing a change and it's like one of those things that you could really check off your list if you're
Yeah.
willing to do the work, you know?
So I'll work with clients who are already in therapy for other things, right? Because I usually will not work with a client who's already in therapy with another therapist. But with this specific goal, that's something that I work with because it's we don't go into like childhood and you know it's all about the exposure and that's it. That's all we do. That's all we talk about.
Clean.
Um,
I like it.
So I'll get referrals from other therapists saying, hey, why don't you go to this therapist just to work on this fear? And then they're still seeing their regular therapist. So it's all about regaining control and strength, our mental and understanding our mental capacity that we have.
Amazing.
So
Awesome.
yeah.
Thank you so much, Avi. Thank
My
you.
pleasure. This was so nice to be able to connect with you. I did want to say, really, I'm so impressed with OK Clarity, and I think this is such a big need that you know for the Jewish community, a platform with so many other therapists and mental health professionals. Really, I know it's not easy to do something like this, but it's so much needed. And thank you so much for opening the platform for this.
Thank you. I appreciate that. And someone asked a really good question here. Do you only do fear of dogs? So you addressed it like you do other like fears of other animals, but I think like it's, would you say it's like
Fear of other, and I do exposure therapy. That's what my strengths are as a therapist. I've studied it a lot, understanding the conscious and subconscious mind and how it works. I do fear, well, animals is a big part of it. For those who are not following my page yet, they can see all the animals that I have on my page. Like I said, you know, spiders and birds and all these different animals that I have. So fear of animals is one of them. I also do, you know, the fear of when people deal with, you know, going outside, the fear of going to work, the fear of driving, these types of different things. So definitely when they come into session, we talk about these types of things.
it's awesome. I love it. Thank you.
All right.
Thank you everyone for tuning in. It was wonderful.
Thanks everybody.
Have a good one. Have a good one.
Have a good day. Bye.
Thank you. Bye bye.